All right. Well, welcome to this April 22nd, 2022 first meeting of the new Healthcare Industry Sector Council. For the record, I'm Amy Fleming, Program Development and Engagement Specialist for the Governor's Office of Workforce Innovation. This first meeting is going to provide fundamental information to set expectations for future meetings and help us get accustomed to the format and requirements under open meeting law. There aren't any items that require action on this agenda, but I do need to go ahead and take roll of voting members to confirm a quorum. So please let me know if you're present when your name is called. Danielle Brown.
Present.
Thank you. June Eastridge.
Here.
Hello. Joan Hall. I know she had a conflict, so I don't see her here. Patrick Kelly.
Good afternoon.
Hello. Jerry Reeves.
Here, thank you.
Shauna Tello. I see you there. I'm not sure if your sound is working. Don't hear you, but I do see you.
I'm here. Can you hear me
Oh,
now?
yes. Hi.
Thank you.
And Grace Vergara Macdal. Thought I saw SEIU come in.
Hi, I'm Michelle Mayase, president of SEIU. Hello.
Wonderful. Hi.
Hi, thank you.
All right, well, wonderful. So I hereby affirm that this April 22nd, 2022 Healthcare Industry Sector Council meeting has reached a quorum. I further affirm that the agenda and notice for this meeting was properly posted pursuant to Nevada's open meeting law, NRS 241.020. So continuing to agenda item number 3, I am delighted to recognize Isla Young, Executive Director of the Governor's Office of Workforce Innovation, to make a few remarks.
Thank you, Amy, and thank you so much to all of you for joining us today. As Amy mentioned, my name is Isla. I serve as the Executive Director of the Goen Office, and so incredibly grateful, honestly, to have all of you with us. I see lots of new faces, which is very exciting to me. Healthcare is absolutely one of the priorities for the governor and for our state. So it is incredibly valuable to have your voices, to have your insights. And as we're really looking at our healthcare workforce, how can we best support what is needed to make sure that you have what you need with your talent for the different positions within each of your companies. So thank you for bringing your voice. Thank you to Amy for all of the work pulling together such a fabulous group of people. And we are very grateful for your willingness to serve. So thank you again.
Thank you, Isla. So there is another key Goen team member that you should all be familiar with. So I'm now going to recognize Andreas Fijo, liaison to the Governor's Workforce Development Board, to introduce himself.
Hi, everyone. Thank you, Amy. It's a pleasure to see everyone. Good afternoon. Happy Friday. My main role at the Office of Workforce Innovation is to help to run the State Workforce Board, the Governor's Workforce Development Board. So I'm excited to be here today and observe this meeting. The industry sector councils are an important branch of the state board, and I'm happy to see that they're back up and running. And we really hope that the discussion and insights that are generated from these meetings can be helpful to guide workforce development efforts and policy in the state. So
Awesome.
I'm looking forward to the meeting. Thank you.
Thank you, Andreas. All right, so we can now move on to agenda item number 4. So since the state's councils were inactive for a number of years, the Goen team has taken the opportunity to look at these entities with fresh eyes. We've spent the past year sorting through legal requirements, researching best practices, and meeting with stakeholders to develop and revise a plan. So I'm going to share my screen now to walk you through the plan as it is currently being implemented. I'm always afraid I'm going to share the wrong screen, but I think I'm good. Okay. You can hold questions until the end of this short presentation, or you may put them in the chat and I'll check there along the way. All right, so first we're going to start by level setting with a little bit of Zoom etiquette and meeting etiquette. Even though this is now our third year in this environment, we still need some reminders sometimes. So please go ahead and mute yourself when you aren't speaking, but we can take care of that for you too if there's some background noise that's creating a distraction. Please raise your hand and wait to be acknowledged before contributing. Please take a minute to rename yourself now if you haven't done so already. And it's helpful to include your name, your organization or company, and whether you're an employer or partner. So I realize I did not do that yet. So I'm going to do that now. There we go. So I have an example there. If you're not sure how to identify as an employer or a partner, we're going to get to that on the next slide. You are welcome to use the chat box to ask questions, to introduce yourself, and to share contact information, but please don't deliberate on agenda items in the chat. And if you're not sure what that means, we can help you out, but don't be afraid to share your contact information and ask questions there. Oh, did I move ahead of this? Okay, sorry about that. I switched ahead. So on the right side of the screen, I've included a few functional meeting best practices developed by the Center for Story-Based Strategy. Top of the list here, remember that it's important to be curious and creative. Second, we want to remember there is only one microphone, so please try not to speak over others and remember to be called on. Next, I really like this acronym. It's WAIT, which stands for why am I talking or why am I not talking? And it's really just an internal reflection to support meaningful engagement. So next, by being here, you all consent to active facilitation. You may raise your hand or be called on even if your hand is not raised. Finally, please throw glitter and not shade. Be encouraging of your fellow attendees, which will help us create an environment of trust and respect, leading to more valuable collective problem solving. All right, so here's that slide. So everyone is going to be given an opportunity to contribute to these meetings. How you contribute is going to depend on whether you self-identify as either an employer or a system partner. An employer hires individuals in the relevant industry and a partner supports the industry or system. You might be both depending on the topic, but please be mindful of that when you're sharing your perspective. For example, a representative from higher education might be looking to hire individuals in the field, but is also developing and running programs to support that system. So how they might contribute to the conversation will differ depending on the agenda item we are on. So this is a lot of text referencing the governing statute for these councils. It's all to say that these are legally mandated entities that must check a few specific boxes. Beyond that, the vision for these councils is to serve as a formal advisory committee or formal advisory committees that represent a mix of employers, labor, education, and others to provide feedback and guidance to state agencies and systems and strengthen alignment of current and future state resources. These meetings are designed to harness the employer experience, insights, and intelligence so we can strengthen the broader ecosystem. We are committed to leveraging everyone's time and to maximize engagement and to be as inclusive and transparent as possible. We've worked very closely with the team at the Governor's Office of Economic Development in planning for this relaunch. And it's crucial that our activities here align with the state's economic development priorities. The example shown here is from Nevada's Plan for Recovery and Resilience, which was published in 2020. I know they're working on an update. And key takeaways here are that we intend to build on the identified strengths in workforce and education, and to address some of the identified opportunities for improvement. It's very important to acknowledge that the workforce development system and alignment activities are broad. So we are grateful to the many regional networks discussing similar priorities, particularly around healthcare. And we have engaged to leverage opportunities for stronger alignment. Representatives from many of those networks are present here during this meeting to help ensure that this council is aware of opportunities to engage regionally or at the sub-industrial level. So you've heard a few references so far to voting members of this body and have also heard reference to engaging in open discussion. So this slide visualizes the similarities and differences between these two groups. Most of the conversation between voting members and others is not delineated. What is delineated is this distinction between employers and partners. But essentially, voting members will be asked to vote on items that have been agendized for action, like previous meeting minutes. We're expecting there will be some other formal items that rise to the level of a vote, but it just isn't clear at this point exactly what that might be. Okay, so you might also have noticed some of the formality around how the groups have been assembled, what's included on the agenda, and how we're speaking to one another, who is permitted to speak and when. This is because these meetings are governed by Nevada open meeting law, and I've boiled down the key takeaways to what you see here, but ultimately, if you're wondering about procedure, it's likely to come down to open meeting law requirements. A key takeaway is that items can only be voted on if there's a quorum, and for this group, that means 4 of the 7 voting members are present. We are also required to post the agenda publicly well in advance of the meeting, and the agenda must include accessibility instructions and items that will require action. We cannot take action on items unless they are published in the agenda in advance. We are also required to allow time for public comment, and that will fall at the end of each agenda. Finally, minutes will be taken and posted after they are approved at the following meeting. Agendas for these meetings are going to follow a similar structure each quarter. I'm hoping that this is going to help set expectations and provide consistency that will make it easier to dive to greater depths as time goes on. So every meeting will start with employer introductions, so we can capture some of the most critical open positions and acute barriers to attracting or retaining talent in each sector. Next will be a segment on workforce and economic data, which is again followed by an opportunity for employers to provide their reflections on how that data compares to their experience. After that, there will be a partner presentation, and the presenter is going to be selected to address some of the top issues shared in previous meetings. Again, this is going to be followed by opportunity for employer feedback. Finally, we will open the floor to our partners in the room to introduce themselves and give a brief overview of their work and share a program or opportunity most relevant to the issues that are raised during the meeting. I do want to draw your attention to the right side of this slide to point out that there is not a lot of time for each person to speak. It's really going to depend on how many participants engage and attend these meetings, but it's not likely there's going to be time to be fully comprehensive. That said, the hope is that a robust landscape for the sector is going to start to come into focus over time. So finally, and probably most importantly, how will this information that's shared during these meetings really impact alignment in the system? So we are going to be publishing a summary report after each quarterly meeting, and this report will inform many of the partners you see listed here and well beyond. We also anticipate that partners will engage with employers to support grant applications and program development and other activities between meetings. Okay, so I will pause here to check the chat for questions, and you are also welcome to raise your hand and I'll check that as well. Yes, so one question is, will the presentation be shared? Yes, absolutely. We will be posting the presentation and video pretty soon after the meeting, and it will also be shared with voting members via email, but it will be shared on the GOIN website publicly. Are there any other questions? I'll close this. I don't see any more in the chat. I know it's a lot to digest, so you are also welcome to bring questions at another time. Okay. So since there are no questions, no further questions, we can move on to agenda item number 5, employer introductions. So if you identify as a direct employer in the healthcare industry, please raise your hand to queue up. While you do this, I'm going to put a few notes in the chat for you to reference. Okay. So with your introduction, please share your name, your company, and your role in that company. And yes, you can use the raise hand feature. It really does help to put you in the queue. Your name, your role within that company, and please also share your top hard to fill or urgent to fill or in demand positions. This is also a really great opportunity to share any acute barriers to attracting or retaining talent that you've been working through over the past few months. Okay. All right, go ahead, Shauna.
Hi, good afternoon, everybody. My name is Shauna Tello. I'm the Academic and External Affairs Administrator for University Medical Center. I've been at UMC for 25 years, so I've really seen a lot of change in our healthcare system as well as in our hospital, and recently with COVID. So I'm so glad, thank you for having me join this meeting. I think that I'm going to really be able to provide some great information on what's going on in some of our needs. And so what are our top hard to fill, urgent to fill demand positions in demand? So right now, based on my discussions with our Human Resource Department and our Chief Nursing Officer, along with our Chief of Staff, we still have some challenges with providers, especially specialists. So doctors, nurse practitioners, physician assistants, nurses, and this is new to me, I'm hearing CT techs. So that's a new area that we're hearing as well as surgical techs. So those are the very hard to fill positions right now. Some of the reasons that I'm experiencing and encountering and discussing these topics with our leaders in the organization include the fact that the market competition. So, you know, people are looking at what the wages are compared to where the lifestyle that they would want. Remote work is a huge factor because I also failed to mention another position that is hard to fill is our IT department. A lot of that work is being done remotely now. And so people are really taking advantage of that opportunity to work remote, and we're not offering that at this time. So market competition with relation to pay and remote work. Another barrier is some of the portability and licensure issues. Attracting top talent with relation, I see this mostly with physicians, is their spouses. We still have this notion that Las Vegas is only about the Strip, and there's not much quality of life here. And so hopefully with some of the things going on as far as sports being brought into Las Vegas and different industry, we will be able to attract not only the providers that will be working in our organization, but also their family and their spouses. One item also for discussion is we do see our turnover of employees mostly within the first year, and we feel that that may be connected again to the market competition. They get here, they start working, but then there's some bonuses or maybe higher pay offered elsewhere in the community. And then lastly, just taking a look at the college curriculum and availability of professors. So if we go back to how did these professionals and nurses and doctors become the clinical staff that they are, and we go back to some of the community college university requirements, pretty stringent, especially for nurses. So maybe some benefit in looking at that, as well as incentivizing our staff to work as professors on a per diem basis may help drive some of those professions and attract more to the profession as well. So thank you.
Excellent feedback. Thank you so much for being here. Dr. Eastridge.
Hi, my name's June Eastridge, and I'm the Dean of Nursing at Nevada State College. And a lot of the things that Shauna just shared apply to the barriers that that we're seeing. I've been with Nevada State for 8 years, and I was with the University of New Mexico prior to that. 17 years in higher education, 25 years in clinical practice, and there was some overlap in those time periods. And spent a good part of that in rural areas. I'm not exactly sure whether I view myself as an employer or as a support person for the system, or both, probably both. But I've seen a lot, and one thing that is an ongoing problem, of course, is the nursing shortage. And with that nursing shortage comes a shortage of nurse educators. We don't want just anybody teaching the next generation of nurses. We want to keep our eye on both the nursing pipeline and the size of that pipeline, but also the quality of the nurses that we're turning out. And so for the most part, nurses who are experienced, who have gained a level of expertise and have advanced degrees, have graduate degrees, on average, according to the U.S. Bureau of Labor Statistics, around $100,000 annually. And nurse educators average $80,000 annually, nurse educator salaries. It's tough to fill positions. I've got 7 vacant positions right now. That is 25% of our faculty lines that are open. And so to continue to have a robust pipeline, we really need to address the nurse educator wages and how attractive those roles are for nurses. So that is the big one. That is the big, hard to fill, urgent to fill, in demand position that I am seeing every day. We also have more faculty after coming out of COVID that are wanting to work remotely, and for pre-licensure programs, the outcomes data does not support that is the best approach for training new nurses, and that also limits the number of nurses who are willing to make the change into academia. Reality shock for nursing students. We get nursing students into the program, and they begin their clinicals, and we have some who drop out, and then we also see a lot of graduates who quit the profession within the first year or 2 of graduation. And so these are all big challenges that we see as nurses get into the workplace and experience the volume of work that nurses do and the level of responsibility that they carry. So those are the biggest barriers that I'm facing.
Thank you so much for sharing. Jerry, go ahead.
Thank you. I'm Jerry Reeves. I'm Medical Director for Comagine Health, which is the Medicare Quality Improvement Organization for Nevada, and chair of the Desert Meadows Area Health Education Center. So we're both an employer and a partner. And the role that we play at Comagine Health is largely related to the aged and elderly population, which is growing much faster than our healthcare workforce population is growing. And 50% of the spend for Medicaid, which is often thought to be predominantly for young folks, actually is for elderly and disabled. And so it's not just the Medicare, but it's also the Medicaid population, which makes up more than half of all payments for services, for health-related services in Nevada. The other role that I play is chair of the Medical Practice Commission for the State Medical Association and chair of the membership committee for Clark County Medical Society, both of which have major challenges for the medical practice. We have major challenges with licensure delays, so that people who want to come here to work, who have fully been practicing and are fully qualified and fully licensed in other states, the delays are dramatically too long. And so there are some very simple things that could be done with the way our licensing boards process applications that could speed up the time from graduation and from decisions to move here to the time of actually being able to start work. The other is that for making this an attractive place for healthcare professionals to pursue health-related careers, we need better payment, especially for the Medicare is decent pay compared to Medicaid, which is about 40% lower. And a lot of doctors will not accept even Medicare rates. You can imagine moving here from another state where the Medicare and the Medicaid rates are substantially better than here. It makes it very hard to recruit primary care providers, which we have some very severe shortage of. Another thing that would help would be loan repayment programs, because the amount of loans that it takes to graduate from nursing school, medical school, pharmacy school, pick any of these licensed healthcare professions, is very large, and structuring better loan repayment rates in return for folks being willing to serve in virtually every county in our state as a healthcare professional shortage area, and helping with house down payments for young career professionals who are starting their careers. Other places are less expensive to live, helping to help, even if it's something where there were tax credits that could allow private companies to support house down payments, could help across multiple health profession shortage areas. And as has been mentioned earlier, we need more mentors. We in our area health education center work with providing mentors, college students who are pursuing health-related careers, to be mentors for K through 12 students who are in our school districts, to encourage them to consider health-related careers that they've never even thought of as possibilities. We also need a large base of personal care assistants, certified nurse assistants. We need not only the high-end educational level folks, but especially with our growing disabled and elderly population who cannot get health services at their homes where they are homebound. We can provide with relatively inexpensive investments much better support for people to cope and not be able to remain in their homes rather than occupying much more expensive care in hospitals and institutions. So I think there are multiple activities and actions that we together can take that can improve our lot and speed up the addressing of our healthcare profession shortages in Nevada. Thank you.
Thank you, Jerry. I appreciate that feedback. Katie, go ahead.
Thank you. So hi, everyone. I'm Katie Ryan. I am the System Director of Government Relations for Dignity Health St. Rose Dominican here in Nevada. I want to reiterate everything that's been said by my colleagues previously, so I'll be brief and just kind of talk through some of the vacancy rates that we have. So our top needs are med techs, CV surgical techs, and nurses. With nurses, we have a vacancy rate of 9.91% for the entire market. ICU, CV surgical, and then nurse managers really are our biggest issues here. But a lot of the incentives that folks talked about, I think we totally agree with all of that. So thank you.
Thank you so much. Go ahead, Danielle.
Yeah, I apologize. I turned my camera off. I'm having internet connectivity issues at work today. Usually the office is the reliable one. So I'm on my phone as the hotspot at my office. Charles River, we are a preclinical research organization. We do pharmaceutical companies or biotech companies will contract. Demand roles are either entry-level scientists to work in the labs, which are usually, BS degrees, sometimes associate degrees, or higher level scientists, PhDs, master's level, who want to either do some of our lab science work or toxicology work. So, and to me, the biggest barrier right now is the cost of living in Reno, which is where we're located. And the competition, because the cost of living has gone up so much here. We have a lot of entry level or lower level folks for a little bit of extra money because they can't afford to live. So people that would normally not, $1 more an hour is not going to make you leave your job. Well, now it is. So the retention is difficult. And then it's also very hard to attract the higher level scientists because of the cost of living and just not having enough in the local area that are being, pumped out. We have a great relationship with the University of Nevada here, but just the lower number of higher education schools here compared to some other areas makes it a bit difficult.
Thank you so much for sharing that perspective, Danielle. So I don't see any other hands raised. So we're going to go ahead and open up to individuals that work closely with employers. These might be chambers, industry groups, regional partnerships. I know that AHECs were mentioned, and provide the same key information on behalf of your employer stakeholders. At the end of this meeting, we'll have the opportunity for partners to present on behalf of themselves and share the work they do. But at this point, we're still looking at this demand side. I'm hoping to get the amplification of the employer work that you are doing. Go ahead, Patrick.
Thank you, Patrick Kelly, the Nevada Hospital Association. Most of the items were covered. I just want to add to the list, though, phlebotomists, med techs, and lab techs. We're seeing a need for those. And I can't emphasize enough, really, we have such a critical need for nursing throughout the state.
Got it. Thank you. Grace, go ahead.
Good afternoon, everyone, and I apologize for being late. Grace Vergara-Mactal. I'm the Executive Director of SEIU Local 1107. I think I would, agree with everything that Shauna had says, and but one thing that I was just gonna, I just wanted to highlight is, the barriers that we have, and we have community partners. We partners with the Filipino Nurses Associations. Actually, just had a meeting with them yesterday and talk about the workforce issues and and other partners that we have. I think one thing that we've talked about yesterday was the licensure. I agree with Shauna and Dr. Isries and Jerry. All of that is good, but there's also a challenge where they're recruiting nurses from different parts of the world. Yesterday, a particular conversation that I had was nurses in the Philippines. Before you can get the visa, you have to take this, what they call the CGFNS. It's an international licensure that you have to take, which it includes all the necessary skills to be a nurse, including English proficiency. But then when you get here, you have to take the NCLEX, which is a licensure to practice in the United States. But they also add and to get another English proficiency exam. So there is a lot of steps, I think, and I'm not sure if so that's what we were trying to figure out yesterday. Is it a federal regulation or is it state regulations? Because every state has different regulation and licensure. But I think the point is it makes it harder to be part of the nursing program. Pat and I had talked about it a couple of days ago in terms of the students as well in colleges and universities, that you have to take a 4.0 to be a nursing program. I think those is hindrances. That's why we have shortages of nursing. The employers that we represent are short of staff. It's kind of like, is it the chicken or the egg first, right? Because there is a shortage of nurses. The staffing ratio is horrible in other places, but there's shortage of hiring. So we got to balance where the problem is happening, right? But at the same time, it lowers the quality of the patient care, because if I'm a nurse at ICU and I have 4 patients, that's based on the number of patients rather than the acuity of the patients, I think it becomes problematic. But I do understand that there's shortage of hirings. So, and I think the teaching nurse or the educator that I think Dr. June had mentioned earlier too, but yes, I agree the wages, but it's also the requirements. You have to be masters. In some cases, you have to be doctorate. But there are nurses that wanted to educate. If you're a nurse for 15, 20 years, right? I think should be able to teach nursing. So I think the people leaving, I heard earlier people saying people leaving the industry because of the short of staffing, like I said earlier, the chicken or the egg first, but it's all because they're overworked, right? And this remote, I have nurses in hospitals that we represent that they were full-time in the hospitals, but now they took a per diem positions because they can telehealth. They are at home, right? So I think that's problematic as well. That and yeah, let's talk about the tuition fee to be in the program. So I think those I said a lot, but I think those are the things that we ought to be able to figure out. How do we slowly, because it's not gonna change overnight, I recognize that, but how do we slowly figure out how to fix it, right? The tuition is, I have a son, just got out of college last year, and he's not a nurse, but a lot of money, right? So even here in the community colleges, I have friends that their kids wanted to go to nursing school, but by the time you finish school, even in community college, you have thousands and thousands of school loans. So why you can work now, right, without a college degree? So I think those are just kind of what we're hearing from the hospitals that we represent, from our members, from the community partners that we have, and from the allies and progressive partners that we have. So thank you.
Thank you so much for sharing. Thank you to everyone that's shared. I don't see any other hands raised. I know we have some other folks that do work with employers that are in the room. If you would like to share, you are welcome to unmute. I'll give you 7 seconds.
Hi, good morning.
Hi, go ahead, Vivian.
Hi, I am new to this council meeting, but my name is Vivian Arias. I am actually with Dieter. I am in the business services office. I am a business services representative, so I work with a variety of different employers here in Nevada. So it sounds like a lot of partners here are looking into having their positions posted. That is something that I can definitely assist you all with. I can leave my contact information in the box. So I'd be more than happy to assist you all with having your positions posted, or if there are any other services that you might need.
Thank you so much. Please do put your contact information in the chat.
Will do. Thank you.
Sorry, go ahead, Andrea.
Hi, Amy. Thank you. Hi, everyone. Apologies for not having video. I'm in transit, but I just wanted to provide sentiment to in just full agreement to everything that everyone is saying, but also to, I think highlight the importance of public health professionals in our state as well, and to also give some credence to the importance of behavioral health professions throughout the state of Nevada and the needs that we know that we have there. Loan repayment is huge. I think if we can be a little more innovative, if you will, on really digging deeper into the Medicare residency positions and lifting some of those caps to expand our opportunities, and then perhaps even work with the state on how the loan repayment grants go in, because there's a hefty requirement for match that causes problems right away with submission of those federal fund requests that, unfortunately limit what we would all like to see happen for loan repayment. And then finally, just the really, the importance of the Pathway to Practice pipeline, not an immediate fix, but if you know AHEC's really advocate for the importance of K through 12. It's more of a long-term sustainability plan, but really just being innovative in our thinking on how best to leverage the facilities and the industry side to convene the partnerships with the academia side and perhaps formalize those partnerships so that there's a very clear pathway for each of those students who are engaged in STEM as well as CTE, and then perhaps some of that work-based learning opportunity that we know these students so desperately desire and need in order to be exposed to the careers that we know we are beyond, critical need to have at this time. So I just want to inspire and not forget about the importance of investing and cultivating our own, and really the requirement to start younger than we do right now.
Absolutely. Thank you so much. I really cannot overstate how valuable all of this feedback is. It really drives the direction of so much of our work and the work of our partners. So we will provide some partner introductions and hopefully make some good connections at the end of this meeting. But right now we're going to turn to the data portion of our agenda, which includes presentations from 2 key state agency partners. After both presentations, we'll open up the floor for questions, feedback, and other reactions. So I encourage you to take note of some of the key indicators that either resonate with or differ from your experience. So first, agenda item number 6, I recognize David Schmidt, Chief Economist with the Research and Analysis Division of the Nevada Department of Training, Employment, and Rehabilitation. Go ahead, Dave.
Thank you, Amy, and give me a moment here while I get my screen share pulled up. If it sounds a little bit echoey, I'm sorry, I'm in a different room than normal at the moment, so I'll try not to make this too challenging. There we go. So as Amy said, I'm the Chief Economist for the Research and Analysis Bureau of DETR, and also echoing, pay attention to things that you might like to see here, because there's lots of potential data that we could talk about, and I'm not going to try to not make this a 2-hour presentation, but go through things pretty quickly and touch on the broader economy, and then some data about the healthcare sector. That's probably not news to anyone, but just want to let you know kind of what we have available and what directions we could go in providing updates to the sector council in the future. In the state as a whole, this first chart looks at how many jobs we've regained since our prior peak in employment over the last 3 recessions. And what I like to make sure that people are aware of is just how fast this recession, because of the sort of policy-driven nature of the response to COVID, it came on very quickly, and we've been rebounding very fast. Nevada has had the fastest employment growth in the nation on a year-over-year basis for the last, I think, 5 months in a row, and we've been either number 1 or number 2 for the past year. And you can see just how rapid that employment growth is in the dark blue line compared to the much slower recovery that we had from the 2007 recession. Also, as we sit here in March, we're just over 2 years into this. In contrast, in 2007, from peak employment to the bottom in employment was about 3 years. And so we've gone down more than we've ever gone down before. We had the highest unemployment rate in the nation, highest unemployment rate on record for any state back to 1976, and comparable to the unemployment that we had in the Great Recession. From that point, we've come back to where we're nearly recovered. We've gone on a little bit longer than the 2001 recession, which you can see was pretty mild by comparison to what we've gone through in the two recessions since. This chart looks at the jobs that we lost throughout the state and then that we've gained back. So jobs that we lost from February of 2020 to May of 2020, a 2-month period. And then what we've gained in the nearly 2 years since then. The red bars on the left show how many jobs we lost. The blue bars on the right show how many jobs we've gained. The numbers down the left-hand side show you the net of those two, where we are overall. The numbers that are in red, we're still below. We've lost more than we gained and vice versa. If the numbers are in green, those are areas where we've more than recovered everything that was lost. Few highlights here. First, Nevada is within 10,000 jobs in terms of total employment of getting back everything that we lost in that period. The private sector is within 3,000 jobs. It's probably in the next couple of months going to tick over to where we have more people working in the private sector than we did in February of 2020, right before the onset of COVID. Also relevant to this particular sector council, if you go about halfway down, you can see the healthcare and social assistance industry employs 2,400 more people than we did in February of 2020. The broader education and health services industry, which includes both educational services as well as the healthcare industry, also in the positive at 3,300 jobs. Where we've seen the most recovery is in the trade, transportation, and utilities industry. In particular, transportation and warehousing is up, I think, more than 20% compared to where it was in February of 2020. Where we're down the most is in the casino hotel industry, particularly in Las Vegas. That industry is still only about 80% recovered. And you can see the evolution of those numbers on this chart, where the size of the box grows or shrinks based on the size of the employment in that sector. And as the boxes shift from red to green, you can see the overall employment recovery that we've seen. You can see how big the transportation, warehousing, utilities industry is. It's 20% 20% above its pre-recession peak, but it's only 7% of total employment. The healthcare and social assistance industry is about 3% above its pre-recession peak. That represents about 10% of employment in the state. Actually similar to the size of the accommodation industry, though that industry is only about 80% recovered, and you can see it's here in dark green. But broadly throughout the state, most industries are near, at, or above their pre-recession employment levels. It's really government and other personal services and the casino industries that are the slowest to recover right now. That's why total jobs within 10,000, private sector within 3,000, because government is still a bit further away in terms of total recovery. Looking at that education and health services industry, because it's the most detailed level that I can pull this chart for, you can see the trends for Las Vegas as well as the Reno-Sparks area, where we used to say healthcare is the best industry to do projections for because you can just follow the line and it smoothly increases over time. You can see the impact that we had due to the pandemic, in part because of education. It shows up in both industries, but also since that time, that sort of smooth upward growth that we've seen looks like it's been flattening out a little bit. This is not necessarily surprising. This is looks at the healthcare industry in red, all other industries in the state in blue, and it shows the percent change in employment since January of 2000. So we're kind of looking back a while, but you can see here from 1990 to about 2000, the growth path for healthcare and the rest of the industries in the state was pretty similar. But for healthcare, that growth path has continued and even accelerated in recent years. Whereas overall employment in the rest of the state, that really, really rapid growth that we had in the 1990s and the early 2000s has kind of leveled off. We went through the Great Recession. We grew back since that point. We hit the COVID recession, it drops down and we're nearly recovered there. But it's not nearly the rapid expansion that we've seen in the healthcare industry more broadly. So what is the healthcare industry? This chart looks at the size of the box represents total employment in the third quarter of 2021. This is using a product that's released quarterly, but it's a pretty detailed level of the different types of industries that we have in the state. The color of the box, the more bright it is, show those industries that have higher average weekly wages. And so the color and the size of the box kind of shows those industries that pay more, that pay less. The two elephants in the room in the healthcare industry are hospitals, general medical and surgical hospitals, as well as offices of physicians. This kind of makes sense. There's a lot of healthcare that takes place in those areas, but there's actually a really broad distribution here. You also have on the flip side, there's still some significant employment in services for the elderly and disabled, which has an average weekly wage of just $405 a week. It's kind of hard to read with the contrast here. But a lot of these residential services that are providing not the hospital and physician level care, but they have a lot more residential staff and use a lot more home health and personal care aides, which have very different wages. Homes for the elderly, $615 per week. I have to lean and read it close because the font is really tiny, but residential, intellectual and developmental disability facilities, offices of or continuing care for retirement communities. These are some industries that have much lower wages in terms of $500, $700 per week. $615 per week, where the average in Nevada runs about $900 to $1,000. And so there's a really wide distribution of the types of people that are included in the healthcare industry and what the overall mix of employment there and wages in the industry looks like. This chart I have to explain a little bit. It came out of one of our previous sector councils, so you guys get to see it for the first time. The numbers in the background here refer to different areas of the state. 3 is Clark County, 31 is Washoe County, 510 is Carson City. I would have made it pretty, but we're in the middle of moving offices, and so this is what I've got right now. But this shows the comparison for the 3 largest areas in the state, Clark, Washoe, and Carson City, of what the picture looked like for the healthcare industry in 2004, sort of a couple years before the start of the Great Recession, and what it looks like in 2021. And really, you can see first that wages have gone up. If you look across between the large blocks, you can see, for example, in Carson City, offices of physicians went from $1,272 per week in 2004 to $2,300 per week in 2021. Similar for general medical and surgical hospitals in Clark County, 944 to 1517. This is 17 years. Wages go up over time, not particularly surprising there, but also that the relative mix of employment in terms of the size of the boxes between these areas has stayed pretty consistent over time as well. That we've seen this growth, but as the healthcare system has been growing, unlike say manufacturing, where you have a very large manufacturing entity show up and kind of shift the distribution of everything, in each of these areas of the state, the broad mix of employment has not changed significantly over this 17-year period. The wages across the board, as we would expect, have been rising. Shifting from employment to unemployment, this is back to the statewide level. This chart shows Nevada's unemployment rate over time, with the gray area showing the most common distribution of unemployment rates for other states. And you can see Nevada is typically toward the middle of what other states have experienced. We get to the Great Recession and we move up ahead of other states for a while. We get to the COVID recession and again, nearly 30% unemployment. But also just in terms of the broad economy, I think it really helps to reiterate, like in typical recessions, you see this sort of rolling hill. It goes up and then it comes down as everyone is adjusting and figuring things out. And I think one of the real challenges that we've faced with the COVID recession is just how fast everything happened. Like I feel like a broken record on it, but to go through the amount of change that we've seen in as short a time as we've seen just causes lots of challenges in the supply chain, in workers finding childcare so that they can go and look for a job, and all of these extra effects that when you're not going through a multi-year cycle, but you're in a really compressed time frame. It's a lot of change happening really fast, and I think the time for people to adjust is a really important element of what's going on here. Nevada's unemployment rate as of March is sitting at 5%. 5% by any historical comparison is pretty low, and yet it's still one of the highest unemployment rates in the nation. Nationally, we are seeing really, really low unemployment. But this is not necessarily uniform across the state. As of March, the unemployment rate in the Reno area is 2.6%, one of the lowest rates we've ever experienced. The lowest rate on record was December of last year in 2021, where it hit 2.4%, rate we've never seen before in the Reno area, going back to 1990. And what that means is that throughout the whole economy, the number of workers is a really, really tight market. There's not a lot of people out there looking for work that don't already have jobs. Looking at this from the perspective of unemployment claims, if you take the average claims in February of each year, you have to go back to 1990 before you have the same volume of claims. And in 1990, there were a lot fewer people living and working in Nevada. And so the level of claims that we're seeing is really, really low, echoing that really low unemployment. Even in Clark County, you're looking at an unemployment rate that's, I think, just a titch above 5%. Typically a pretty tight labor market. One caveat to this that comes up is labor force participation, which means if you're in the labor force, according to the Bureau of Labor Statistics, if you are employed or if you are actively looking for work, which means you've been looking for work within the last 4 weeks. If you are haven't looked for work in the last 4 weeks, there's a couple of other measures. Did you not think there were any jobs? Did you have medical or childcare challenges? But it's interesting to see what that participation rate looks like back to 1976. In gray, you can kind of see the rise and fall that all states are experiencing. There are some broad demographic shifts happening in the country as we have the baby boom generation reaching that sort of retirement age and starting to shift. And so we've had broad declines in the participation rate really dating back the last 20 years as this older generation has been starting to age out of the workforce. For decades, we've had a lot more participation of women in the workforce. We've had a cohort that wasn't really participating in the workforce at the same rate, but over the 1960s, 70s, 80s, 90s into 2000, you have more and more women starting to participate in the workforce, which pushes the participation rate for the population as a whole higher. But that trend has largely also kind of leveled off, where you have much more similar participation between men and women than you had in those periods. And so some of those gains also are no longer pushing the rate up. In Nevada, a state where we had the largest population growth in the nation for decade upon decade, we had really high participation as people are coming here, looking for jobs, finding jobs, just participating at a really high rate. You can see how far above we are the 80th percentile for all other states. So we're probably close to the top in the country back in the 70s and 80s. As Nevada kind of grew and matured, we moved into a more similar level of participation as the rest of the country. We were hit particularly hard by the COVID recession because of the types of industries that were really affected and the size of the leisure and hospitality industry in Nevada. And even as we've been recovering, our participation rate is still a bit lower. And so while we have really low unemployment, we also have slightly lower levels of participation. That doesn't necessarily mean these are people who are out there looking for work. For example, if people are moving to Nevada to retire and take advantage of the warm climate that we have in Las Vegas, if you have people who are moving to the area that aren't intending to work, you would expect to see the participation rate sort of move down a little bit over time. And so I think as we've grown and matured, there are some changes to what the participation rate for the labor force in Nevada looks like. A few more charts. These are national data because this doesn't come from something that we have at the state level, but talking about the shifts and the turnover and the churn that we have in the labor market right now. The number of quits and the number of job openings that we've seen has been particularly in the news a lot. And you can see in this chart, I'm looking at job openings on the vertical axis and the rate of hires on the horizontal axis. And I have a black line that represents 1-to-1. So one job opening per hire in that industry in a given month. The red line is where you would get if you had 2 job openings for every 1 hire that we're seeing. And the healthcare and social assistance industry, you can see is even up above that line. It's one of the few industries where you have more than 2 job openings for every single hire that's taking place on a monthly basis. Most industries that have a similar level of job openings, you can see on the far right, where you have accommodation and food service, leisure and hospitality, arts, entertainment, and recreation, also professional and business services. These are the only other industries that are really in a comparable place to the healthcare industry in terms of the sheer volume of job openings as a share of the size of the workforce in that industry. And most of those other industries are being affected in particular by low pay work. Like that, it's much more common that you have low paid industries that are seeing this higher level of hires, higher level of quits, higher levels of job openings, just more turnover overall. But that's not really true of the healthcare industry broadly, though there are some areas of the healthcare industry that may be affecting that, because there is this broad distribution between the professional medical doctors and nurses on one side, and then the home health aides and personal care type industries on the other side, where you have $400 a week and $2,000 a week existing within the same industry. So it's possible that some of this effect is coming from there, though from everything that we heard earlier today, looking for work is looking for workers is definitely a challenge across that entire spectrum. But it definitely highlights just how high the churn in the healthcare industry is. This filters out some of the noise, because otherwise it would be pretty much impossible to read. Unfortunately, healthcare and social assistance pops up in yellow, so it's still nearly impossible to read. But this looks at, instead of hires and job openings, this is hires and quits. So if you have a lot of people leaving the industry, that would be showing up on the vertical axis. The same level of hires is showing up on the horizontal. But here I have an arrow to show how has this changed over the past year? What is the evolving state of these industries? And these are all kind of what I called professional service industries. And so you have professional and business services on the top right, also includes temporary support workers, which is an important piece of where I think what's driving that being as far up and to the right as it is. Down on the lower left, you have finance and insurance, financial activities, educational service. The red line still represents a 2-to-1 ratio, but here it's where you have 2 hires for every 1 person that's quitting. And so most industries are kind of along this red line to some extent, where even though the level of quits might be rising, every arrow that moves up is an industry where quits are rising. The level of hires is rising at a comparable pace. And so there's churn and turnover, but it's not necessarily growing or shrinking. It's just, or because we're down below the black line, we have more hires than quits. And so we are net adding people, but you don't necessarily want to be turning over 1/10 of your workforce every month. That would be a particular type of challenge, and that's what we can kind of see in this chart. So we do see that quits are rising in the healthcare industry. Hires are also rising, and that the rate of hires nationally is outpacing the rate of quits. And with that, just a few links to various resources within the DETR workforce and UI system. This is not everything that's out there, but you can see our webpage at nevadaworkforce.com. And if you ever have healthcare questions about the labor force, we are here to help. And you can always email us at DETR LMI, that's DETR Labor Market Information, at deter.nv.gov. And with that, I will turn it back over to Amy. Thank you.
Thank you so much, Dave. And I see some great questions and comments coming into the chat. So we're gonna keep those coming. Again, take note of any items that resonate or differ from your experience. But we're gonna jump right into agenda item number 7 and recognize Chelsea Wahlberg, a research manager with the Governor's Office of Economic Development. Go ahead, Chelsea.
Thank you, Miss Amy. Hi, everyone. As Amy mentioned, I'm the research manager over at the Governor's Office of Economic Development, and I have a more pointed presentation from economic development perspective for you today. So I am briefly going to go through employment trends and structural changes in Nevada's economy on a much smaller scale than what Dave just presented for you. And then I'll dive into the health and medical services industry, which is our GOED defined health and medical industry, and then move on over to health science career cluster, which is slightly different from the industry. That is actually a group of occupations rather than an industrial group. So it's looking at the same type of employment, but just from a slightly different lens. So the effect of COVID on Nevada jobs, I'm sure you're all well aware, but we peaked right before the pandemic at 1.4 million jobs, and then realized a really, really quick drop and a sharp increase back up. We've added 300,000, sorry, my brain today. 335,300 jobs have been added back from the trough, and we are just ever so slightly below that pre-pandemic peak. So I anticipate we'll be above that really shortly. So looking at how health and medical services has diversified over the past 11 years or so, in comparison to other industries that GOED focuses on. So you can see in 2010, health and medical services accounted for 7.3% of total industry employment. Right before COVID hit, was at 8.2% of the total employment. And then our most current data shows health and medical services takes up 9.1% of total employment. And you can kind of see, if you look at these individual industries, that the trends that were occurring before the pandemic were just pushed along much, much faster than they were occurring before the pandemic. So tourism, gaming, and entertainment had been shrinking. The pandemic hit and it shrank a lot. And all of the rest of the industries, aside from mining and aerospace and defense, have been increasing quite a bit. Mining holds pretty steady, and aerospace and defense grew only slightly. So looking at health and medical service industry employment in 2021, there's 131,200 some odd jobs. That is 27% below the national average. Between 2011 and 2012, that employment did increase 43%, and that compares to a national growth of 21.3%. So even though we are below the national average, we are growing faster than the nation. So hopefully we can catch up in that employment. And also Nevada pays slightly higher, just ever so slightly higher than the nation, $75,268, which is the median in 2021 compared to the national average of $75,195. So looking at the employment by zip code, I kind of pulled out Washoe County and Clark County so you can see a little bit closer in this map of where all of the employment is located in the state. No surprise here that Clark and Washoe is the bulk of employment, but healthcare is also very important to the rural areas, and so it does exist elsewhere. There are 7,806 health and medical businesses in Nevada total. 75% of those are in Southern Nevada, 21% is in Northern Nevada, and the remaining 4% of those businesses are in the remainder of the state. Another way of looking at that industry employment by region, Las Vegas has 95,676 jobs in the region, while Reno has only 24,747 of those jobs. And you can see how Reno has kind of held closer to the US in change over the years. It's been growing about the same pace as the US, while Las Vegas is growing much faster. health and medical services is one of the only industries, honestly, that is so heavily focused in female employment over male employment. 73.7% is women. This age curve is pretty typical for all industries, honestly. Most employment concentrated between that prime working age of 25 and 54. 46.6% of workers in the health and medical service industry are white, followed by Hispanic or Latinos at 21.5% and Asian people at 16.5%. So this is location quotients. What a location quotient is it's a comparison of industry employment in an area compared to that of the US. So if an industry has a location quotient of 1, you have the exact same concentration of employment in your state as the US does. So we like to look at this a couple of ways. We chart the 2021 location quotient compared to the change over the last 10 years in location quotients. And then we're able to categorize each industry into one of 4 categories. So a mature industry is one that the location quotient is very large, but over time that percentage is decreasing. We have transforming industries that have both a low location quotient and a decreasing location quotient. An emerging industry is one with a low location quotient, but it's increasing. And a star is high location quotient and it's increasing over time. So we would classify health and medical services as an emerging industry. I think you all know how very, very important health and medical services is. And so I would love to see that get pushed up into the star category, probably more than any other of these industries, especially considering what's gone on the last couple of years. But health and medical services has a location quotient of 7.73. So that's about 73% of what the national average of that concentration of employment is. This is our shift share analysis. What shift share analysis does is it lets you know how many jobs are added to an industry just because the industry is growing nationally, and how much of that employment is added due to the competitive factors within that region that makes it unique. So this is known as the rising tide raises all boats kind of theory. So if the tide's rising, all the boats are going to rise, right? So if national employment is rising in health and medical services, it's going to rise in Nevada. So there were 39,442 jobs in health and medical services that were added between 2011 and 2021. 19,585 of those jobs were added because the national tide was rising. The remaining 19,857 jobs were due to the competitive effect that Nevada has over other states. Moving on to the health science career cluster. So we're moving away from industries and into occupations. So occupations can go across different industries. Health is a really interesting case for this. There's actually less jobs in the health science career cluster than in the industry. I think because health jobs are much more specific to the healthcare industry. And healthcare industry is going to include things like office staff and IT and things like that. So these are really just those medically centric careers. So there are 120,513 jobs in 2021, which is 16% below the national average, with a 14.6% growth over the last 10 years compared to 6.6% in the nation. And again, Nevada tends to pay more in these occupations than the nation does. So as you can see, pretty much all of these jobs, at least if you're looking in the top industries there, they're all very specific to healthcare. So general medical surgical hospitals is the #1 most specific industry that these occupations exist in. I don't think that comes as a surprise to anyone on this call, but it kind of goes down from there. So the top health science occupations by how large those occupations are, #1 would be registered nurses. Again, I don't think that comes as a surprise to anyone. And then if you look at the little green boxes with the numbers in those are the high demand occupational rankings that come from GOED's office. So these are how these occupations rank in terms of how we would like to diversify our economy and what occupations we are going to need in the future to meet the expectations we have of growth due to economic diversity. So registered nurses rank 15. You can see a lot of these larger occupations actually ranked below 100. There are 700 some odd occupations that are ranked in that list. So anything above 100, especially above 50, we consider that high demand. So just a brief overview of in-demand occupation analysis, because it's something that I would love to get feedback on in the future. So we derive the ranking by identifying which jobs are part of our target sectors, real-time job postings, occupational employment projections, STEM scores, job openings, wages, and this year I included an automation and COVID risk. I will probably take out the COVID risk next year, but it was important for this year. So once all of these factors are taken into consideration, the occupations are ranked depending on the score that they have. What this occupation analysis is lacking is a qualitative feedback from professionals like yourselves in your industry, working in your industry. I would love to have some sort of factor that I could include in where you all could look at the list, especially the healthcare occupations, and say, this makes sense and this doesn't make sense. I would rank this higher, I would rank this lower. So hopefully in the future, that's something we can all accomplish and I can include it in the next iteration. But looking specifically at which occupations are primed for growth according to their ranking, #7 on the ranking was licensed practical and licensed vocational nurses, followed by medical scientists at 11. You can see every single one of these in the top 10 for healthcare occupations fall above that 100 ranking, most above 50. Healthcare is absolutely ranked at the top when we look at it in the industry level summed up. So healthcare is absolutely in high demand from GOED's perspective. Looking at educational mapping for the health science career cluster, just a quick note on this data, it does come from IPEDS. IPEDS does not include a lot of the private schools, and the data isn't always the best, but it is what is available to me. So I include it because I think it helps, but just keep in mind that it should be taken with a grain of salt. So there are 148 programs in 2020. There were 12,810 completions, and that compares to 12,457 openings. Completions to openings obviously is not a one-to-one metric, but I think it's helpful to know what are we putting out versus how many openings are we having. It's helpful to know if there is some sort of mark that's being met. So the top 5 healthcare educational programs are registered nurses, liberal arts and sciences, nursing assistant, medical clinical assistant, and psychology general. Liberal arts and sciences likely falls in there because it's useful to one or two of those occupations. And so all of those 1,186 completions are probably not necessarily going to healthcare, but that is useful to an occupation somewhere in there. It was mapped to it. So there were 3,754 distance offered programs and 9,056 non-distance offered programs. That's an important metric because that 3,754 completions, those likely belong to people who live in a rural area or are unable to go in person for some reason. It just provides more opportunities to people who aren't able to get traditional learning. I think it'll be important in the future, especially if more COVID strains pop up or more pandemics happen. I think that metric will see a shift in the future. The #1 institution for health science career programs is College of Southern Nevada, followed by UNR and UNLV. And finally, my last slide for you is job postings for the health science career cluster. I just kept it to 2021, but I do have data through whatever the most recently ended month is. So I have through March. But there were 20,361 average monthly postings in 2021, and that compares to 28,178 monthly hires. That's honestly pretty close. Registered nurses was the occupation with the most monthly postings. And we do tend to see a really big separation between monthly postings and monthly hires for nurses. That's been the case ever since we started getting this kind of data. Hospitals just tend to spam a lot of registered nurses because they can be hard to find and they want to make sure that they have that out there. So they do try to deduplicate this data. So it's not that there's a bunch of the same posting out there, but just important to keep that in mind that some of these occupations are that way. And that's all I have for you today. So thank you.
Thank you. Okay, so we're going to open up for questions. I saw some come in the chat that I want to make sure we get to address. So do we have underemployed statistics that would help in reaching those that might jump to a higher paying job? Are there metrics on underemployment?
David Schmidt again for the record. So underemployment can be kind of hard to capture. One of the sources that we use for that comes from the Bureau of Labor Statistics. They produce measures on labor underutilization. And those do include people who are not in the labor force, but are looking for work. Like they've looked for work in the last 12 months, but they don't believe that there's jobs currently available for them, or they're not in the labor force, they do want a job, but there's some other barrier that they're facing, which they call just marginally attached. Unfortunately, it's hard to get either timely or really detailed with those statistics because the sample that's used to collect that data is not large in Nevada. And so even those relatively high level measures only come out on a 12-month rolling average basis each quarter. I should say a 4-quarter rolling average. And so the data that we have currently available looks back to periods that are still into early 2021. They're not like, where are we right now? Who is not in the labor force right now? And so capturing the most timely data on that is tricky. Otherwise, the question would be, is there a program that's serving these people where they could receive some assistance? And that could be through like a job training service. They come in and they're like, hey, I want to be this, but I'm only this right now. And so there might be other touch points where there could be some data collected on that. But as far as like a comprehensive across the economy, where are the workers who might want to move up? It can be a bit challenging. And I should mention the other group that's out there is in these alternative measures is people who are working, but are doing part-time work, but would like full-time work. And so it's people who are involuntarily part-time employed. But those are probably the best measures that we have statewide on underutilization. And just from looking at the data recently, the two non-working categories, your discouraged workers and marginally attached, are not particularly large in the entire state. We're talking about a few thousand, I think. So it's not a comparable to the 60, 70,000 people that we've had unemployed recently. It is a much smaller subset of the total.
Great, thank you. I know there was a question too about the health educator wages being included, and you did answer that in the chat as well, but I didn't know, maybe if you can share, I think it's helpful to hear you explain it. So the question is there a health care educator, are healthcare educator wages included in the average weekly wage data?
And so David Schmidt again for the record. The data that I showed us, I think this is in reference to that tree map that shows the average weekly wages and relative employment size. That was only looking at NAICS code 62, which is a way of classifying business establishments based on the primary activity that takes place at those establishments. And I filtered it down in part because the broader healthcare NAICS code list that I had included some things like biotechnology research with average weekly wages of like $8,000 per week on average. Very high pay, very small, but completely blew off the distribution for all of the other wages in that industry. So I kind of limited it a little bit to just the businesses that are providing healthcare services as their primary activity. And so I think it would definitely be worthwhile in terms of what we've heard to see if we can get a breakout that includes educational institutions that are providing healthcare training. Chelsea may know better than I if there is in fact a NAICS code that captures that based on her prior experience. But if there are business establishments that are reported separately that are providing those healthcare instructional activities as their primary business activity, then we should be able to capture it. If it's just a part of like University of Nevada, Reno, or University of Nevada, Las Vegas, we probably couldn't get down to that specific program because it would be just captured in the university averages as a whole.
Interesting
So I
and
will look into
challenging.
Yep.
Thank you. So another question is, are non-clinical healthcare jobs such as research positions and veterinarians included in this?
I'm assuming that's for the career cluster. So veterinarians and veterinary assistants are included. As far as research is concerned, a lot of the research positions do end up falling in these just general health medical SOC codes. They're not necessarily separated out. But I do have a really detailed report that goes through each of these occupations and the education related to it that we have in Nevada and all that. I'd be happy to pass that on to Amy so she can send everything out in one thing.
Thank you. Yeah, and I do want to acknowledge, I know David referenced previous meetings and that he'd updated what he made available, and that's just I want to point that out because the questions that you ask and the feedback, your perspectives, help us understand what's important and valuable to you so that we can make adjustments in future meetings. So I really wanted to reiterate that. So I'll move to some of the comments along those lines. So comment that the shortages may feel worse than the statistics reflect because population growth, especially of high needs seniors, are much higher than the growth rates of health service labor force. So I don't know, Jerry, if you wanted to expand on that or if you feel like that covers.
Well, I just think that we have low level of services that are available compared to what seniors are used to receiving in states like California, where they move from. And so the amount of expectations of our population, of our healthcare workforce, are much higher than our healthcare workforce can meet. And so it's hard to reflect that in the numbers where you show there are more graduate medical education programs and and therefore more doctors in Southern Nevada than 10 years ago. That's true. But when you look at what's biologically happening with the needs of the people we serve, there's a discrepancy between the numbers and the reality.
Tremendously valuable. Go ahead, Chelsea.
Well, and Jerry, and to your point, a lot of those, especially doctoral candidates, people who are graduating with that, may have their residency elsewhere and they're not going to come back here. So even if they graduated here, they won't be staying here. And so that educational data, especially when it comes down to some of these occupations and things that do require residencies, aren't really captured in the whole picture. So that kind of feedback is really helpful.
Mm-hmm. And then another comment that healthcare administration degree programs are key in the development of hospital administrators. So not direct patient care, but very important to hospital operations and leaders. So I know that's captured in the industry data, but not the occupational, or go ahead.
So there is medical and health services managers in here. I think that's the closest that we get to that. I'm not sure. I'd have to look at the SOC list to see if there's something above that, but I think that is where hospital administrators would fall, honestly. So that data should be in there. It just isn't one of the top programs in my presentation.
Wonderful. Well, thank you so much for all of the questions, all of the comments. Is there anything else that anyone wanted to just share now? This conversation, the feedback that you're providing is fantastic, but I also want to make sure that we move through a little bit the agenda. Any other comments or questions before we move on? It helps to put them in the chat. I appreciate that. Okay, so we're going to shift gears a little bit to the partner side. Agenda item number 9 is a partner presentation, and this quarter we will be featuring the NetBRIS platform, which connects Nevada's industry professionals with the state's middle and high school classrooms. Each quarter, presenters are going to be selected to address some of the key themes that are being pulled from your feedback in previous meetings. So I'm going to launch that. Getting a black screen, which makes me nervous. Can you see my NetBRIS slides?
Not yet.
No, I see a black. Oh,
It says it.
my internet then.
Happened the last meeting, so it's going to bump me out of the meeting, but you should all stay in. Thank goodness. It's just the
It says you need to double click on to enter full screen.
the same thing happened last time, and I don't know why my video is not working now, but that's okay. I do not know. It's like too overloaded. All right, here we go. Is it a blank screen?
There you go.
Oh, okay, good. All right, technical difficulties. All right, so NetBRIS is a national platform that's being supported in this state by GOEN and the Nevada Department of Education. And this investment is being made to address some of the key gap that's been identified in conversations with employers and educators throughout the state. So after this short overview, we're going to spend just a few minutes to turn back to you to get your immediate reactions and better understand how you see being able to use this tool and what challenges you might anticipate for broader implementation within your company, organization, or network. So it feels sometimes easy to say that the connection between industry and education is essential, but how do we actively facilitate that connection? Educators, particularly in these past few years, are supporting our state's children on many levels. The foundations and skills that are established in K-12 education are absolutely fundamental to career trajectories for Nevada's young adults. So first, we're going to look through some of the challenges, both for educators and employers, that have led to the investment in NEPRIS in the state. So first, Nevada's employment landscape is shifting intentionally, which you've seen a bit in the data. As new companies relocate to regions across the state and existing companies evolve to remain competitive, we're seeing a demand for new and emerging skill sets. So number two, one of the reasons many of us are drawn to this state is because we have incredible remote landscapes. But with that, many of our communities, in rural communities, but also in our metros, are geographically isolated. And this makes it difficult to expand the scope of opportunity. I think I know. Oh, no, I don't know why. Okay, so number three, students need to be exposed to opportunities that may not yet exist in their communities or in our state, but these opportunities are absolutely will exist in the very near future. Number four, Nevada's booming economy is transitioning at a pace we just haven't experienced before. And then finally, related to all of these is the transition to the future of work. In order for existing and emerging industries to remain competitive, Nevada's emerging workforce must understand local opportunities and be able to think beyond what may be immediately available. On the educator side, we understand there are increasing difficulties with arranging offsite engagements. In many regions in our state, there just are not buses available to get students to school, let alone to field trips. Also, because of elevated safety or security on site, some employers are just not accustomed or able to accommodate visits for minors. Number three, it can be very challenging for educators who, again, are already stretched very, very thin to research and reach the right company contact for the most relevant experience they're looking for. And finally, we are still dealing with COVID and the future is unpredictable. And we are seeing in-person engagements often need to be canceled or adjusted at the last minute. And so folks across the board are looking for quality virtual alternatives. So for all these reasons, the state of Nevada has been investing heavily in the adoption of the NEPRIS platform. The Nevada Department of Education and the Governor's Office of Workforce Innovation have partnered to provide full access to every public middle and high school educator across the state. The NEPRIS platform connects industry professionals with classroom students virtually, removing the barriers of geography, time, cost, and coordination. This platform allows professionals the flexibility to be proactive or reactive with their engagements and aligns their passion and interest to short micro engagements on a wide variety of topics. So with this investment, Nevada has created a partner page called NEPRIS for Nevada, which captures all of our state's engagement under one umbrella. NEPRIS for Nevada currently has more than 8,000 educators in the system, with every school district in the state represented. There are also more than 90 industry professionals, ranging from Tesla to the Nevada Arts Council to High Sierra AHEC, who's here, and many others represented on the site. Okay, so there are three primary features on the NEPRIS site. One is industry-driven, one is educator-driven, and these sessions are then recorded and published in the third feature, which is a video library. What you see here are a few of the many, many different ways that the system can be used to strengthen these connections. So I'm going to play this really short video and hopefully Zoom does not crash again. And it's really the best way to understand what this system can do.
Since 2013, NEPRIS has been bridging the gap between industry and education, bringing real-world relevance and career exposure to all students, while enabling companies and professionals to share their skills and knowledge with the future workforce.
Oh, darn it. I always do.
Through virtual career days, field trips, mock interviews, capstone project presentations, and more, we break social and geographic barriers to provide exposure to career pathways that students never knew existed.
So what is it that I do currently? So I'm the owner and creator of a brand called Kicksart, which I started in 2014. Initially, I started creating YouTube videos. So here's an example of some of the thumbnails of my content.
You have a love for jump roping. If you've ever been a cheerleader, you could get a scholarship for that. Academic, career specific, and then sports.
In every lab, you will see that we have freezers that are super cold. This is minus 80 degrees, so that the tissues or samples that we have can be preserved for a long, long, long time.
Why you? There's about 4 other people I'm going to sit down with. Why should I choose you over everybody else?
I'm very hardworking and I don't give up until I succeed.
Suggestion would be, I would just focus again, going back to what is really your why? What are you trying to solve? And why is that important?
We're going to say print, data, head, 10. And so this is our syntax. This is how we're speaking Python, speaking with our computer.
Happy connecting.
I just love that. It really gets the wheels turning to how you might start to engage in classrooms, which I know a lot of you are doing already, but this is a pretty easy way. So it's your move. So you can go to nevada.nepris.com and click sign up for free. I'm going to put it in here for everybody to go to. And then just fill out your profile and start to explore. I do not have time today. I want to make sure we have time for partner introductions, but I am happy to do a site demo, walk through, talk to you, brainstorm about how you might use the platform to start to engage with students across the state. So I can take questions, but also please feel free to reach out at any time for some additional information. So I'm going to put this in the chat. Okay, so I'm going to stop sharing my screen. And this too is an example for how partner, I don't see myself on the screen. I'm not sure if my screen is black. Okay, well, I can't get it to fix, so sorry. I love it. For how partner presentations are expected to go in the future. But so I would love to get some reactions from you just quickly. And if you want to put them in the chat when we move on to the next agenda item, you're welcome to do that too. But just curious what your reactions are. How do you see being able to use the tool, and what challenges do you anticipate for implementation? How readily do students engage with NEPRIS? So right now, there are actually 3 open requests in the system in healthcare. They're all veterinary requests. So I know that we don't have experts in the room right now, but I'll be reaching out to some folks shortly. But we get about 3 or 4. Oh, great. I'm going to reach out to you, Danielle. We have 3 or 4 requests a week from Nevada schools. But the requests from all over the country there are probably 25 to 30 open requests at any given time. Okay, well, I am then going to see if I can first fix this really quickly, and then if not, I'll move on. Oh, gotta love it. I can't fix it. So that's okay. You don't need to see me. All right. So I'm going to move on then to agenda item number 10, which is the opportunity for partners to introduce themselves. So please share some of the key resources or calls to action given what's been shared by employers throughout this conversation. I'm going to put those prompts in the chat for you. Given the time that we have left here, please do try to keep your comments around or under 2 minutes. And while I put that in there, I'll answer Jerry's question about NEPRIS, which is do requests drive the content? So it's 2-sided. individuals, and yes, please go ahead and raise your hand and I'll call on you, but I'll answer this question while you do that. So two-sided, so teachers can make requests for professionals to come and speak in their classrooms, and professionals can post what's called an industry chat. So it's essentially a webinar on anything that they want to talk about. But sounds like I'll be connecting with you in a little bit to see how we might get you into classrooms or your partners. The best way is really to understand it is really to see it. Okay, so I'm going to go ahead and call on partners for their introductions, and you should see that prompt in the chat. All right, so go ahead, Bill.
Good afternoon. For the record, Bill Regenhart, LVGEA. I just wanted to share with everyone that, you know, in addition to focusing on bringing business into Southern Nevada, we also focus on business retention and expansion. And I am the Director of Workforce Development and would be happy to help any employer with expanding their workforce and providing the employment resources that are available here in Southern Nevada. Through a variety of organizations and groups, and I'm here to help. So feel free to reach out to me at LVGEA. Thanks.
Thanks so much, Bill. I know Andrea posted in the chat an introduction. Andrea, did you want to unmute yourself and give a quick introduction?
Sure. Thank you, Amy. I missed it and I apologize, but love being your partner. I'm Andrea Gregg. I'm the Chief Executive Officer for High Sierra AHEC. We're located up in Reno, Nevada, but have the great privilege to collaborate with Dr. Jerry Reeves, who's on this call down at our Desert Meadows AHEC in Las Vegas, and also have another location up in Elko. And we are an organization that focuses primarily on healthcare workforce development. So what we're doing is just really trying to be innovative in our strategies. We start very young in the pipeline. Here at High Sierra AHEC, we start as young as 5th grade for all of our programming, and then we cultivate that programming all the way through those students on the pathway all the way upwards to graduate level school. And then on the latter side of the pipeline, we are also a content provider and a CE/CME provider for those healthcare professionals who are practicing. So we love what we do because we get to see the full spectrum of that pipeline development, and we really liaise between the academic partners in addition to the industry. I'd say the most relevant program or opportunity to engage, we're about to launch later in August the state's first community health worker pre-apprenticeship program, just as an example, where we're providing that certification to high school students and then convening with the right partners to place them for paid work-based learning, and then also providing the comprehensive wraparound services that will be required and or needed to support some of these students in hopes that they upskill to the level 2, and then ideally perhaps leverage the CHW position and discipline, if you will, as a launching pad to further expose those individuals to the rest of the healthcare opportunities that our state needs, and then keep them in our pipeline to ensure that we're training them and upskilling them so that they can continue to be employable assets as they stay on that trajectory. That's just one example. We have many of wonderful programs, and we're just here to serve as a resource however we may, and to support all the great work that Amy and Isla and everybody's doing over at Goen.
Thanks so much, Andrea. Other partners that want to introduce themselves and maybe share a couple of the resources with the group? I will call on you. I know you're out there. Go ahead, Earl. Can you introduce yourself?
Good afternoon, it's Earl McDowell, Hope for Prisoners. We work with the second chance population, assist them in getting jobs and, you know, making them exposed to different arenas as far as employment goes. And I know few people that we have interacted with in the program have indicated they're interested in positions in healthcare. In a lot of cases, they can get into healthcare because some of their offenses are not the ones that would, you know, impede them from doing that. But again, Earl McDowell, Hope for Prisoners. We're here in Las Vegas. We just moved to our new facility, so we do a lot of training with them in many different areas. Thank you.
Thank you, Earl. Jen, did you want to share a little bit about the CTE programs across school districts in the state?
Sure. My name is Jen Fisk. I took over for Randy Honeywell at the Nevada Department of Education. So I'm in charge of all of the health science, public safety, high school CTE programs in the state of Nevada. We're currently redoing our standards. I'm looking for medical assistance. If anybody wants to reach out and wants to be a part of that standards review team, that would be phenomenal.
Wonderful. Please put your contact information in the chat. We heard from Dieter Business Services Office earlier, but I'm not sure if anybody wanted to else wanted to share what resources might be available through that team. Trying to look and see. All right, I'm going to give you 7 seconds of pause and then I'm moving on. It's very uncomfortable for me to sit in silence. Okay, so next is agenda item number 11. I quickly wanted to get future meetings on your radar. We're looking at 2 remaining meetings for 2022 and are aiming for November 8th and November 7th. So please note those dates and stay tuned for details. So before we move on, I need to check for voting members that arrive after roll call. So you can identify yourself, but I will go ahead and identify Grace Vergara Mactel. Can you pronounce your name for me one more time?
Vergara Mactel.
Perfect. Thank you. And then I think Joan Hall was the only other one, but she's not available. Oh, did I say November 7th and November 8th for future meetings? Future meetings are August 8th and November 7th. Thank you. August 8th and November 7th. Okay. Finally, agenda item number 12 before we adjourn is public comment. So this is the space for members of the public to provide additional comments. So as a reminder, no formal action can be taken on any issues not included in the posted agenda, and public comments will be limited to 3 minutes per person. So you can raise your hand or unmute yourself to be recognized for public comment. All right. So hearing no comments, then I hereby move to adjourn this meeting.